Hey YouTube, it's Losing Melanie. Melanie here. I was just coming in to check on you guys and let you know how I'm doing. I'm 3 weeks, 5 days pre-op for my lap band surgery on March the 15th, 2011. I started my pre-op diet at 6 weeks pre-op. Just on my own motivation to get a little bit skinnier, and so I'm kind of checking in to let you guys know. I started at 6 weeks pre-op at 265 pounds. I weighed in on my weigh-in date, which was actually Tuesday morning. I'm a little bit late getting around to posting this, but it was 255.4 for a total loss of 9 pounds or 9.6 pounds. I'm pretty much the same today. I was on call last night, which means I stay the night in the hospital after working my regular shift. I spend another shift in the hospital and work until noon to 1 o'clock the day after, and so because of that, I didn't have an opportunity to weigh in this morning, and yesterday, which was Wednesday morning, I weighed the same as I did on Tuesday. So I am guessing that I'm probably still hovering right there. I'll know tomorrow morning when I wake up and have a chance to actually weigh at my usual time. But I'm doing pretty good. I am wanting to lose hopefully another 10 pounds in the next 3 weeks and 5 days. I will go on the usual pre-op diet a week before the operation, and actually 2 weeks before my operation. My surgeon, Dr. Kirschenbaum in Denver, Colorado, asks that I go on a no-carb diet. So it's like 2 weeks of induction with Atkins. So I'm gonna be doing that. Right now, I'm doing more of a loosely low-carb diet. I'm not really being as strict as that, and I'm allowing myself to indulge in a couple of things that I know I won't be able to eat for a while until my band matures. So I'm okay with that, you know. I think we should celebrate a little bit, and he actually told me to. So I have it on my surgeon's recommendation that I go out and eat some of the meals that I really enjoy as a celebratory farewell, because you know, I won't be able to eat them in the same way after the surgery, which is a good thing. But I think that, you know, New Toy for Katie had mentioned in one of her older videos that she really was angry and frustrated at times about not being able to enjoy some of her favorite meals the way she did before. So I am guilt-free and allowing myself to enjoy some of my favorite things here and there. And of course that is limiting my weight loss. 90% of the time probably I am actually being good on my diet. Like tonight I had a salad with chicken for dinner, and but for lunch today, I had a baked potato loaded, and that's one of the things that I will very much miss. I love baked potatoes with everything on it, and that's a slider food, so I know I really will be limiting that in the time ahead, and that's okay. I'm okay with that. I would much rather have knees that don't protest every time I go up and down stairs. I would much rather feel like I belong in my skin, feel like I'm, you know, able to be active with my kids and do things with my family, and I think it's well worth it to give up that baked potato in order to get all of the health rewards that I'm going to have when I lose all of my weight. And I am pre-diabetic. My mom was diagnosed with diabetes when she turned 40. My grandmother was 40 when she was diagnosed. I have an uncle that was around the same age when he was diagnosed. Very strong risk factors for me, especially being overweight. So far, I've not been diagnosed, but a couple of my babies were really big babies, which is kind of suggestive of having insulin intolerance while I was pregnant, although it wasn't caught with my glucose tolerance testing. So I'm pretty sure I have some insulin resistance. I have some physical signs of insulin resistance, and so I know I'm already on that road, and I wanted to get this lap band done before I have high blood pressure, which I'm not sure if I'm catching it before I have high blood pressure or not, because there are days at work when I get really stressed and I can feel like my blood pressure is up. I'll have a headache, my eyes will pulse, and I just feel like my blood pressure is probably up. I know, I'm a doctor. I should know better than to go untreated, but I keep telling myself it's okay because I'm losing weight and I'm going to not need the medicines when I'm done anyway, so I don't need to get on them just yet when I'm so close to starting this journey. Not the best medical advice. As they say, doctors make the worst patients. And I truly embrace that because I've not taken care of myself in very many years. So, but I'm starting. That's what this is all about, right? Don't look to the past, look to the future, and I'm going to get this under control. The other thing is I have to make a choice. My knees, I have advanced osteoarthritis in both of my knees. I've already had to have a knee surgery on my right knee because of an injury back in high school, and that started the process of the arthritis in that knee. But the other knee has developed the arthritis since then because I allowed myself to get overweight. So exercise is going to be a huge problem for me. There's a lot of things I cannot do with my knees like this. But there's hope, because as I lose weight, that pressure on my knee and the constant inflammation in my knees will lessen with every single pound that I lose. And I hope that I will be like Banded Wendy and running 5Ks before too long. I'm very hopeful that I will not need further surgical intervention for my knees when this is all said and done, because I'm really, really hoping that losing weight will be the answer. I currently have a torn meniscus in my right knee. I know it. There's not much I can do about it right this second. My schedule's just too busy, and I want to lose weight before I have an orthopedic surgeon take a look at it anyway. So I'm just kind of coping with it and having to modify things. And I'm going to get through this. I'm going to wake up a year from now and think, I can't believe that I have gotten this far and I've done this well and my health is so much better. So I can't wait for that day. I can't wait for the lap band surgery. I can't wait to feel more like the me that's on the inside. And I want the inside me to match the outside me. So you guys, I hope you're having a fantastic week. I am exhausted, so I'm going to get to bed, and I wish you many blessings and hope to see you soon. Thanks.